Let's take you here now. UKZN Professor Mosa Moshabela says South Africa should not ignore COVID-19 lessons from other countries. He joins us now for more on this. Thank you very much, sir, for your time this afternoon. So you draw comparisons to the UK and Portugal in terms of what they went through. What are some of the similarities that you have noted in terms of what it is that we see and what we can learn?
Thanks, Dudu, and greetings to your viewers. My interest lately has been kind of looking at where we can draw lessons from, given the fact that, we now have experience with COVID-19 and we now have experience with the first and the second wave. And not only in our country, lessons that we can learn from the first wave, but also from other countries that seem to be having similar patterns to ours. And I've been struck by how all of us are sort of assuming that the pattern in the second wave is going to follow a similar pattern we saw in the first wave, where after the peak, the graph is just going to go down and things will be calm again. And then when I started to look around, and you can see a clear pattern in other countries that actually when they've gone over the peak, and instead of going down, their curve starts to go up again. And that for me kind of worried me. And I started to look at different countries that are going through similar those kind of patterns, and there's a lot of those countries. I just used examples of the UK and Portugal, but you can see similar patterns in Ireland, in the US, and other places. And this concerns me in terms of how prepared are we in South Africa for the kind of curve that we're going to have. Is it going to actually continue to show a steady decrease after the peak?
Just on that, right? So what did you note when it came to healthcare systems in South Africa and some of the countries that you compared it with? Yesterday, speaking to the South African Medical Association, concerns being raised that we have nurses who are in ICU wards and they're not even trained to be there.
Yeah. No, certainly. I think on the one hand, you have an issue of the healthcare system in terms of how it responds to the infections. And we know that our healthcare systems are not as robust as some of these European countries. But on the other hand, you've got all these risk factors that are contributing to new cases. For example, in Ireland, when the Christmas holiday came, they basically stopped about 500,000 people from coming home for Christmas and only allowed close to 50,000 people to come home for Christmas in order to prevent the surge. So there's those risks. But then also on the side of the hospitals also, we are seeing these countries being overwhelmed. I mean, we never expected that countries like UK and Portugal and Ireland would be overwhelmed. They are all now in hard lockdown in order to try and limit the pressure on the healthcare system. In South Africa, we know that our economy may not cope, and level 3 so far seems to be a fair compromise between the needs of the economy and the country and society, as well as the resilience of the healthcare system. So we cannot necessarily go beyond that. And for that reason, we need to think about our own ways through which we could try and protect the cases from increasing so that we can limit infections and pressure on the healthcare system and continue to sustain livelihoods.
What do you propose some of those ways would be?
Yeah, so I think because we are quite eager to basically relax the restrictions, one of the most important things is going to be the timing of when restrictions are going to be relaxed. If we relax them too soon, we may end up finding ourselves with another surge shortly after, because we're dealing with a virus that is highly transmissible. And in all likelihood, it could transmit the moment socializing begins. And also now we also want to open schools, we want to open businesses. We have to really think carefully around how we are going to release those restrictions. My suggestion would be to maintain level 3 restrictions for a little bit longer, even though they can make exceptions to some restrictions that have been put in place. For example, issues like the functioning of the schools and so forth could be looked at and see how they could be protected and opened in a safe manner, whereas some restrictions continue. But I don't see that South Africa would be able to cope with an immediate, release of restrictions and lifting of level 3 restrictions too soon. We have to really wait until we can see a steady downward trend in our curve.
Just curious to find out if you managed to compare South Africa with other countries on the continent. Much has been said about the doom and gloom that will befall the continent, but when you take a look at the numbers, not nearly as scary for an entire continent as predictions had been. What do you suspect is behind that?
Yeah, I mean, for us, on the continent, really, it's been difficult to compare because a lot of the countries on the continent have been struggling with capturing the cases with the level of accuracy that we would be comfortable with. So we've been looking at Nigeria because it's highly populous, but a lot of indications suggest that they may not be reporting similar to the way that we report. So it's very hard to do that. And so for me, I think that on the continent, there's probably a lot more cases than we actually acknowledge. We have struggled in terms of documenting cases, struggled documenting deaths, and so forth. However, I think that it's still important for us to monitor the functioning of the healthcare systems in those countries. So we're monitoring the coping of the health facilities and health institutions in those countries, just to see how they're coping, how they're responding. But nevertheless, I do acknowledge that actually it's been quite a pleasant surprise to actually see how many of the African countries have, on the whole, coped well with COVID-19. South Africa is also unique because it's also very much linked to international networks and travel and so forth, and the economy is different. We've got our own contextual challenges, but we also have better resources relative to other countries. However, I do think that when it comes to the burden on the continent, it's really been a pleasant surprise. But we still need to make sure that all these countries have access to vaccines and they've got systems in terms of public health and healthcare systems to be able to distribute those vaccines.
Thank you very much for your thoughts this afternoon. Professor Mosa Moshabela, he's with the University of KwaZulu-Natal.